Right, on the medical front here, Korean health authorities are looking to secure more beds for seriously ill COVID-19 patients, and Won-jong joins me now to tell us more. Won-jong, welcome.
Good afternoon.
Right, so I understand an administrative order, that is, has been issued to make more hospital beds available. Tell us more.
Right, this is the fourth time the Korean health authorities have issued administrative order since the pandemic started. It calls for the provision of more hospital beds for severely ill COVID-19 patients. Now, the order comes into effect starting on this Friday with a focus on the Greater Seoul area over fears that daily caseload could hit the 5,000 or 7,000 mark, maybe even beyond.
The government will prepare enough beds that can handle demand, even when the daily caseload goes over 10,000.
Now, looking at the hospital bed availability across the country, as of Friday, there are a total of 1,111 beds for severely ill patients and 555 for patients with less serious symptoms. By administrative order, 22 large general hospitals in the Greater Seoul area will secure 402 more hospital beds for patients with moderate symptoms. Now, the goal is to have 1,365 beds for severely patients and 857 for less severe patients and more than 11,000 for other patients.
I see. And staying with that, Won-jong, what can you tell us about the number of severely ill patients currently here in the country?
It's a little early to say that, but it's definitely concerning at this point. If I just give you a little updates on this, on the number of severe cases as of Thursday, that we had 365 patients in hospital care due to serious health complications, which is 13 fewer cases than the previous day. Now, today is a little bit higher, but however, according to the recent report from the National Institute for Mathematical Sciences on Friday, that figure could jump to over 500 within 2 weeks and 800 in a month. Now, this forecast is based on the reproduction rate of the virus from October, which is currently at 1.3. A figure above 1 means an increase in infections is expected. For this reason, some experts saying that the booster shots need to be rolled out as soon as possible for those in high-risk groups. Now, looking at the availability, like I said, the hospital beds across the country as of Friday, there are a total of 1,111 beds for severely ill patients. But again, if there are over 800 severe cases next month, as predicted, this could put a strain on the Korean healthcare capacity.
Right. Hopefully that will not be the case. 800 severely ill patients, of course not. And as you mentioned, like our colleague Soa said earlier, we have 17 more severely ill patients today, raising that figure to 382 as of yesterday. That would be Thursday.
Exactly.
Right. Won-jong, traveling to the UK now, I understand that country has now become the first one to grant the green light to an oral COVID-19 pill. Tell us more.
Exactly. Yes, the UK's drug regulator has approved the antiviral pill molnupiravir, developed by U.S. pharmaceutical company Merck. The country's approval of the oral treatment drug, could be a game changer in the pandemic. Now, take a listen to what this expert had to say.
To have a drug like this, to have an antiviral that's potent, that's able to be taken orally, is a very important moment and does mark a milestone in our discovery of effective medicines against COVID.
As of now, though, the details regarding how quickly the pill will be available are unclear. Molnupiravir has now been cleared for use on people over 18 who tested positive for COVID-19 to help manage symptoms and speed up their recovery. The drug has been closely monitored by experts with data showing that the pill could reduce the rate of hospitalizations and deaths by half. The UK government so far has secured enough pills to cover 480,000 patients. The Merck is expected to produce enough drugs for 10 million people by the end of this year and at least 20 million for next year.
Right, and authorities here have also pre-purchased those pills for the members of the public in the country. Thank you for now, Won-jong. Stay with us for the broader talks.
Of course.